Chapter 24 here, hematologic, which is dealing with the blood, and renal emergencies. Those are the topics we're going to cover. The hematologic system, blood, right, represents its own organ system. It has specific functions, controls bleeding by clotting, delivery of O2 to the cells, removes carbon dioxide, and removal and delivery of other waste products to organs that filtrate and remove them. So it's made up of solid components. If you guys remember talking about cells before, red blood cells, white blood cells, platelets, and all suspended in plasma. Medications can affect some components of the blood, right, such as blood thinners. Aggregation of platelets is body's most rapid and initial response to stop bleeding. Clotting factors are a group of proteins produced in the liver and released into the bloodstream. Once it's activated, clotting factors form clots through clotting cascades. Coagulopathies, abnormal clotting of the blood, can occur when body forms clots too readily or a patient clots too slowly. Certain diseases make patients prone to poor clotting, liver disease when it's advanced, hemophilia, they don't clot well, and von Willebrand disease. So identifying the patients with these medical conditions. All right, certain medical conditions, meds in which the normal ability to form clots can worsen the patient's disease. These patients are prescribed blood thinners. Typically, you'll see patients with previous strokes on blood thinners, some cardiac issues are on blood thinners. Patients more prone to have life-threatening bleeding when injured than patients not on these medications. So that clotting factor is reduced. So bleeds can be definitely worse with these patients, okay? Treat them as you would any other, with the pressure, dressings, etc. Anemia is lack of normal amount of red blood cells. You have acute anemia, sudden blood loss, typically due to trauma. Chronic anemia is excessive menstrual periods, slow GI bleeds, diseases affecting the bone marrow. Sickle cell anemia is different. Genetic disease affecting the red blood cells. It's more prevalent in African Americans, Indian or Middle Eastern descent. So the shape of the red blood cells resembles a sickle, okay, rather than the oval or circular. Cells have a short lifespan, leading to anemia. So complications with this, destruction of the spleen, sickle pain crisis, especially with exertion, acute chest syndrome, priapism in males. Remember that's your erection there. Stroke. It can clot very easily with the shape of these cells. And jaundice. 1 in 12 African Americans has the sickle cell trait. Trait doesn't always lead to complications though. Possible to lead a normal life with the trait. So with patient care, administer O2, titrate to effect, monitor for inadequate respiration, look for signs of hypoperfusion, transport to a stroke center if stroke is suspected. Always do a stroke assessment. So the renal system. Got 2 kidneys, 2 ureters, that's from the kidneys going to the urethra, which expels the urine. Again, 1 urethra. It's responsible for filtering blood and removing waste from the body. Maintains a fluid balance, your pH, right? Maintains acid-base balance. Diseases affect many different portions of it, range from minor to life-threatening. Okay. Urinary tract infections, UTIs, most common disease that afflicts the renal and urinary system, especially in elderly patients. It's caused by bacteria, usually limited to the bladder. Patients will have pain, frequent urination. If left untreated, can result in a pyelonephritis, possibly. UTI, it sends up ureter into the kidney. These can also lead to sepsis if left untreated. Kidney stones, usually made of calcium and formed within the kidney. When in the kidney, they can cause no symptoms. When they become dislodged, can cause unilateral flank pain that radiates to the groin area. Patients may report nausea and vomiting. They're going to be in extreme pain with these. And this can affect any age group, honestly. Just talked to a friend of mine the other day. He is 20 years old and dealing with kidney stones already. Patients with urinary catheters can be a result of renal obstruction of bladder outflow, neurological disorders. They use catheters to drain the urine from the bladder. It is commonly inserted in the urethra and may be placed through the skin. Complications of UTI and local trauma at site of catheter insertion. Anytime you have a call like these, they typically will change them quite frequently. You need to ask when the last time it was changed, any changes in their condition, check for fevers, other signs of a UTI. Renal failure occurs when the kidneys lose ability to adequately filter and remove the toxins from the body. Acute failure typically results from shock or a toxic ingestion. Chronic may be inherited or is secondary to damage from uncontrolled diabetics or hypertension. So end-stage renal disease, irreversible renal failure, requires dialysis, hemodialysis, peritoneal dialysis. 90% receive hemo in specialized centers, your kidney centers, your dialysis centers. You will actually run a lot of calls for people that are on dialysis. More than 400,000 Americans on dialysis who are treated in the centers undergo 3 treatments a week, each lasting 3 to 4 hours. 3 treatments a week, which they have to go for that long to have everything filtered out because their kidneys can no longer do so. About 8% treat themselves at home. Typically, you don't run into this very often. If you do, they're going to be your best source of information. End-stage renal disease patients often rely on EMS for transport to and from dialysis. Some of these patients are bed confined, or they're unable to drive themselves. They may require oxygen for transport. A lot of your transfers are for dialysis patients. So hemodialysis, the patient is connected to a dialysis machine that pumps blood through specialized membranes. Treatments last several hours, multiple times a week, typically 3 times a week. All it's doing is filtering the blood and then putting it back to them. Here's a little diagram. Again, this is in your book. You can kind of see how it works. The sites where they may have fistulas or whatever already put in, sometimes they have to start the IVs on site. These will bleed very rapidly. They have to have these special clamps once they leave to keep pressure on the site to prevent them from bleeding out. You can see it goes through there and filters it out and returns it. So 2 types of access to the blood. You got your two-port catheter, then you have your fistula. Here's the 2-port catheter for the hemodialysis. A lot of times it will be in the chest there. Again, these patients will be able to tell you if they have one. That is a fistula. Very easy to see. So they surgically connect an artery and a vein, typically in the upper extremity right there. You can see those very easily. They engorge. You can never take a blood pressure in the arm with a fistula. You don't want to damage that. So peritoneal dialysis uses the cavity's large surface area. Special fluid is infused into the abdominal cavity, left for several hours to absorb all the waste and excess fluid, and then it's removed and discarded. These will typically be your at-home ones. Continuous ambulatory peritoneal dialysis. gravity exchange process repeated several times a day, or you can have a machine used to fill an empty abdominal cavity while the person sleeps. There's the port for that where they drain it out. Personally, I don't think I could sleep with all that going on. So two broad groups here: loss of normal kidney function and complication of dialysis treatments. Okay, most dialysis patients have underlying medical factors, diabetics, where they don't control their diabetes, they don't take care of themselves, and hypertension. Usually relate to patient missing dialysis. We have a patient in Kiwani, constantly misses dialysis, very frequent flyer. First question I ask as soon as I walk in the door, because she's not feeling well. She missed her dialysis today? Yeah, how'd you know? Well, because you feel like shit, and you do every time that you miss dialysis. They need to be there to have all those toxins and everything filtered out of their body. They will present signs and symptoms similar to congestive heart failure, shortness of breath, they'll have edema, electrolyte disturbances. So if they've missed their dialysis, again, always assess ABCs, obtain vital signs. Again, like I said before, watch out for that fistula. You don't want to take a blood pressure over there. O2 if needed, titrate to effect. Monitor vital signs closely and have the AED ready. I don't ever have the AED ready. I'm not too terribly worried about these patients coding on me. Typically, they're going to call the day that they miss or the day after, and they're just not feeling well. They just need to have everything filtered out. Transport to a facility capable of dialysis. If they've called 911, you're going to transport to a hospital, and then they will transfer the patient for dialysis. Some hospitals can do it there in the house, but you're going to go to the hospital. So complications of dialysis. They can have bleeding at the fistula site, extreme bleeding, clotting and loss of function of the fistula, bacterial infection of blood due to contamination at the fistula or dialysis catheter site, and peritonitis. So care for these guys. Assess ABCs as always. Control the bleeding. Direct pressure, elevation, and hemostatic dressings as needed. If you're at the dialysis center, like I said, they will have those clamps, pretty cool looking things. They need to be on the patient. I believe it's at least for 20 minutes. If bleeding cannot be controlled by other means, a tourniquet should be applied. It's a life-threatening bleed. They will bleed out quickly. Administer O2 as needed. Treat for shock. Keep patients supine, keep them warm, keep them under blankets. If they're hypotensive, elevate their legs. If peritonitis is suspected, transport dialysis fluid for confirmation. Never had to do that. Again, the patient will be able to tell you more about the condition. These are typically the ones that are done at home. Kidney transplant patients. Kidneys are the most commonly transplanted organs. Approximately 16,000 transplants per year. Patients spend their lives on special class of drugs, help prevent organ rejection, increase susceptibility to infections. Quick review here. Blood delivers O2 to the cells, removes carbon dioxide, and controls bleeding by clotting. Covered all this before. Got red cells, white cells, and plasma. Anemia is a lack of red blood cells in circulation. The sickle cell anemia, inherited disease. Remember, it's primarily with African Americans, Middle Eastern Indian descent, and it affects the shape of it. It's like a sickle, right? This causes a lot of different issues, cause sludging, and blockages in smaller blood vessels. The renal system is comprised of kidneys, ureters, and bladder, and the urethra. Kidneys perform vital filtering of blood to remove waste products, and it helps maintain the water balance in the body. Problems include infection, kidney stones, kidney failure. Kidney failure is a condition in which the kidneys are unable to filter waste and provide a balance of fluids and electrolytes in the body. They have to have it artificially filtered by dialysis. removes the excess fluid and electrolytes from the body by filtration. Can be performed two ways, hemodialysis or peritoneal. Hemodialysis is at a center, generally performed 3 times per week, few hours at a time. Peritoneal dialysis is done at home, several times daily. Major complications in patients with end-stage renal disease can occur after the patient has missed a dialysis appointment. Infections, or as a result of bleeding from hemodialysis access sites. Remember, blood has specific cellular components. Abnormal blood cells can significantly affect the patient's renal system is critical to maintaining homeostasis. Renal failure is either chronic or acute. End-stage renal disease is managed through dialysis. So does my patient have a history of sickle cell disease or end-stage renal disease? Do they have a fistula? And again, if they have a fistula, how does that affect your vital signs? Can't take a blood pressure over there, right? If you're working with a paramedic, they should never be starting an IV in a fistula. And you want to ask patients if they've had a previous fistula, okay? Sometimes they've had one on one arm, there was complications with it, now they have it on the other. And you still need to ask them if they've ever had any fistulas in the past. Will I need to make an early request for ALS because of complications from a missed dialysis appointment? Honestly, no. There's nothing that we're going to do for these patients other than comfort care, okay? We'll start an IV, maybe give them something for the nausea, but that's it. Critical thinking. You have a patient who is transported routinely for dialysis 3 times per week. She was sick and canceled the trip yesterday. Now she calls saying she can't breathe and feels like she is going to die. Is it possible that she has a legitimate complaint after missing dialysis by only 1 day? It is possible. It is possible. It could be an issue that has nothing to do with missing dialysis entirely. You need to assess the patient thoroughly and figure out the root cause and treat accordingly.